Hey, what's going on? I want to give you a report on room 101A. His name is Ben Carazo. He's a 58-year-old male, full code, no known allergies, and he has a renal diet. He's alert orange times 1 to person. Diagnosis, well, his initial diagnosis when he came here was sepsis. The initial blood cultures came back positive. The growth was in the aerobic bottle. It was gram-positive cocci in clusters after 104 hours. Now, they did do repeat blood cultures and it came back negative. And so they're thinking that the growth in the first blood cultures was probably due to contamination, and that's why there are no active treatments for sepsis right now. So, no treatments for sepsis. They think it was a false alarm. But what I did notice regarding sepsis was that the white blood cells were elevated today at 13.8. I did make the doctor aware during my shift of the elevated white blood cells, but they didn't want to do any treatments, so that's fine. So why is this patient actually here? The real diagnosis is altered mental status, cirrhosis, and encephalopathy. So again, this patient's alert orange times 1 to person. He is positive for ascites, he's jaundiced. So for his encephalopathy, the treatments I did today were Rifaximin. I gave it twice today. I also gave him Lactulose. It's ordered for 5 times a day, but I did skip the 2 p.m. dose. The doctor is aware, and the reason why I skipped that dose is he had 5 loose BMs. The doctor states the goal is 3 to 4 BMs daily. The patient is more alert today, so the doctor was okay with it. Now, other history regarding this patient, history of metastatic RCC, which stands for renal cell carcinoma. Also has history of nephrectomy, end-stage renal disease, and hemodialysis. So regarding the hemodialysis, it's Monday, Wednesday, Friday, and today's Friday, so he did go today. He has a right AV fistula, and it's positive for bruit. Now, regarding his dialysis today, he did go in the morning. It lasted about 3.5 hours, and initially they did want to take out half a liter of fluid, but they changed their mind at dialysis. They took out 0 fluid, and the reason why is the patient became hypotensive during dialysis. Their BP was 88/55, but asymptomatic. Either way, he was hypotensive, so they did treat it in hemodialysis. They gave him albumin with good result. The BP went up to 112/65. Other history of hypothyroidism, diabetes, and hypoglycemia. So I did do his finger stick today. The last one is at 6:30 p.m. and it was 132. Patient also has a history of hypertension and hypotension, like we just talked about. But the last BP at 4 p.m. was 108/68 and a heart rate 72. He wasn't hypotensive for me when he was on the floor. Now my assessments, neuro-wise, again, alert orange times 1. He does follow commands. No cardiac issues. He's not on tele. Respiratory-wise, no issues. He's breathing regularly, unlabored, and there's no supplemental oxygen. Skin-wise, he's jaundiced due to cirrhosis. He does have that right AV fistula. The dressing's clean, dry, and intact. No signs or symptoms of bleeding. GI-wise, his abdomen is distended. It's positive for ascites. Bowel sounds are present. He does have a left inguinal hernia. He's passing gas. And he was incontinent of stool 5 times today, those loose BMs, because of the lactulose, right? Musculoskeletal, he has generalized weakness, all extremities. He was in bed mostly for me during the day. GU-wise, he was incontinent once. His urine is yellow, and remember, he doesn't really pee a lot. He has hemodialysis. IV access-wise, he has a 22 gauge left forearm, and it's a good one. I just flushed it, and it's patent. It was placed on 6/13/23, so it's due for change on the 17th. So you got today to change it. Well, no, tomorrow to change it. And there's no continuous fluids running through that IV. Last vital signs at 4 p.m. Temp was 36.8, heart rate 72, BP's 108/68, respiration's 19, and O2 status 98% on room air. Pain-wise, patient didn't have any pain for me during my shift, but if he does complain of pain for you, you do have PRN Tylenol. I didn't give any of it today. Abnormal labs for me. Again, the white blood cells were elevated. Doctor's aware. I also noticed that his kidney labs were elevated. The BUN was elevated at 30. Creatinine was 6.6. But again, this patient is end-stage renal disease, so that's kind of expected, and the doctor is aware. Liver labs, ALT and AST are surprisingly normal, despite the patient having liver cirrhosis. I found that interesting. Test-wise, no tests today. He didn't go to any. Medication-wise, he took all ordered meds with me, but honestly, I did give the morning meds a bit late this morning. I gave him like around 11:30, and the reason why he was at dialysis most of the morning. But he does take his pill whole with water. And other useful info for you to help you during your shift. The daughter was a gem for me, really helped me with the patient because he could be kind of difficult at times. So if you ever want to call the daughter to help you out, she did give us her number. It's 999-888-7777. She said you could call her anytime. And I did notice that he really likes vanilla yogurt. So if you want to get on his good side, give him vanilla yogurt. Now, any questions for me regarding this patient? Cool, awesome. Good luck with him.